We're here today with our client Shanté, and she has some questions about what she would best do to get rid of some fine lines that have just started to bother her up here on her forehead, and also the frown, and to give her a little bit of a brow lift without making her look frozen. So that's a common concern when people start doing Botox for the first time. And here in the Pacific Northwest, most people actually don't want it completely frozen because that looks kind of weird. And that's not a look that I like, so I usually don't go for that. And it's a kind of a shared agreement. We'll come to an agreement about what you really want. So go ahead and frown for me. That particular frown probably is going to use about 20 units and still leave you some movement. But because you've never done it before, we could go down as low as 12 and still get some softening and a preventative effect and even a little bit of brow raise in how we place the injection. You'll notice you have these high points right here. That's the edge of a certain muscle. As long as we make sure that we put a little bit in the edge of that muscle, it actually weakens this depressor and allows your brow to come up a little bit like that.
Okay.
So that brings us to the fine lines. So raise your brow. Okay, so those are very fine, and you'll notice if you look at it, they're centered over your brow because your brow is starting to lose a little bit of volume up here, and that's a normal beginning of the aging process. So functionally, we don't want to take it all away, but we want to soften it and prevent it from being a deeper line. And so you can do that depending on how many lines people have, and you have very little, with as little as maybe 4 units to as much as 20 units. People ask me if Botox is preventative. It really is. The younger you start it, the less creased in lines you'll have in that particular area because we just stop you making that muscle movement as often. And so you just don't have the chance to wear those lines in.
Okay.
Okay, go ahead and frown. Perfect. That's about as bad as it's going to be now. You're going to feel a little bit of pressure. And this is the part of the injection that will give you a little bit of a brow raise, while still keeping it soft. You're all done.